Hello, everyone, and welcome to Incredible Health's webinar on how Alameda Health transformed permanent nurse hiring and retention, lessons for healthcare leaders. I'm Jen Lupton, Chief Revenue Officer at Incredible Health, and I'm joined today by Bri Wheatley, our VP of Client Success at Incredible Health, and Ro Lofton, Chief Clinical Officer at Alameda Health. We're grateful that you've taken the time to join us today. For today's session, I will be hosting a fireside chat with both Ro and Bri, and we'll do a deep dive into how the industry has evolved over the last few years. We will discuss some of the current trends impacting the healthcare industry, and then we will look ahead to where the industry is moving. Lastly, if time permits, we will open it up to questions from the group. So please feel free to ask questions along the way by putting them into the Q&A box, or you can always email us at questions@incrediblehealth.com. The Incredible Health team will follow up afterwards with a recording of the event and answer any remaining questions that we don't get to today. Before we get started, Ro, would you mind sharing a little bit about yourself?
Sure, Jen. I'm Ro Lofton, Chief Clinical Officer at Alameda Health System. Alameda Health System, located in Alameda County in California, is 3 acute care hospitals. We have 1 affiliate hospital, which is our St. Rose campus, a psych emergency department. We have 5 wellness centers. We have our post-acute areas, our skilled nursing areas. So we're a large health system in Alameda County. We're also the county's only level 1 trauma center. We're a STEMI receiving center, and 2 of our hospitals are stroke certified centers.
Thanks, Ro. We're so glad you're here today and really appreciate you sharing your strategy and learnings with the larger group. So, Bri, before we get started, would you mind sharing a bit about yourself as well, and then maybe a little bit about Incredible Health and our mission?
Yeah, of course. Thanks, Jen. I'm Bri, and I oversee client success here at Incredible Health. I work really closely with our health systems across the country, including Ro and the Alameda team. And really, we're helping to attract, hire, and retain permanent nursing staff faster and more efficiently. And I'm really, really thrilled to be with you all today. To share a little bit about Incredible Health, here at Incredible Health, every single day, our software and services help healthcare professionals find their dream permanent jobs and to manage their careers. We've done this by putting our healthcare workers at the center. Our vision is to help healthcare professionals live better lives, and our mission is to help those workers find and do their best work.
Thanks, Bri. Now let's ground today's conversation why this matters. Across the country, healthcare leaders are grappling with a fast-changing employment landscape, including burnout, shrinking candidate pools, and an ever higher bar for workplace expectations. But we at Incredible Health don't believe in waiting for change, we build it. As Bri mentioned, at Incredible Health, we accelerate how permanent nurses and allied health professionals move into roles where they're needed most. Our technology, including our proprietary AI matching, improves hiring outcomes by reducing the time to fill, all while delivering an experience that healthcare professionals actually love. Today's conversation is a window into how that works. For those of you that aren't familiar, I want to spend a minute sharing a little bit about Incredible Health, and then we will get right into our fireside chat. Incredible Health's reach spans more than 66% of US metro areas, and 1 in every 3 nurses in the country is on our platform. We work with over 1,500 healthcare employers and bringing together technology, AI-driven matching, and human support to streamline the process of hiring and retaining experienced permanent healthcare candidates. We are not an RPO, and we do not employ recruiters. Our staff is made up of nurses, healthcare hiring experts, software engineers, machine learning engineers, and other contributors that have deep expertise in healthcare and technology. We partner with IDNs, academic medical centers, community hospitals, home health organizations, skilled nursing facilities, and surgical centers across the country. Today, Incredible Health is the largest network for nurses in the world. We have over 1 million nurses and technicians on the platform and are adding over 12,000 new candidates each week. Our nurses have an average tenure of 9 years of experience, and most of them are open to relocating, which allows our healthcare systems to recruit nationally versus locally, opening you up to a much larger candidate pool. Because we are screening candidates and matching based on your job requirements, our healthcare systems have let us know that the hires through Incredible Health have a 15% higher retention rate than other hires. I'm excited to be here today with Ro, who represents one of our 1,500 healthcare employers we work with. All right, let's kick off the questions in our fireside chat. So, Ro, I'm going to ask you the first question. You have
Okay.
mentioned to our team that Incredible Health helped during a really hard time. Looking back, what shifted in your thinking that pushed a hiring strategy overhaul? And what would you say was the biggest catalyst for that change?
Well, Jen, I mean, the biggest catalyst was that there was a critical nursing shortage. We couldn't fill our positions at our community hospitals, and we weren't getting seasoned candidates at our level one trauma center. Just not receiving qualified candidates either locally or nationally was posing a big problem. So we also looked at other things that we needed to do, like elevate our brand visibility and highlight our specialties and our career opportunities. And that's where the partnership with Incredible Health offered a very hopeful solution. And it ultimately proved to be the right one. Having that software app experience, it was enlightening. It was new for us, especially how the candidates were set up. I kind of describe it as a dating app. And it really helped to match the correct candidate with what we were looking for, as well as fulfilling what they were looking for in a job. So far, we've had 30% of our hires with Incredible Health be for our level one trauma center. So we're getting those seasoned nurses now, and 10% of the hires have been for our community hospital, which is great. We've had nurses come from out of state, places like Texas, New York, Georgia, Maryland, and that is amounting to about 21% of our hires.
Thank you, Ro. We do love providing that long-lasting match between the health systems and our talent, as we say, the match.com for healthcare.
Mm-hmm.
Bri, I would be curious to hear from you from the Incredible Health side. Where are you seeing the most momentum or breakthroughs in nurse hiring over the past few years?
Yeah, the first thing is definitely process evaluation and improvement. Speed is absolutely still the name of the game. In today's market, 61% of candidates are accepting the first offer they receive. Even if my second offer comes from Jen and it's for more money, and my third comes from Ro and it's a bigger brand, hospitals that are winning are really deeply evaluating their hiring process from first contact to final offer, and they're cutting out anything that slows them down along the way. The second thing is intentionality with how we meet healthcare professionals where they are. Health systems are being more thoughtful and data driven when it comes to what candidates actually want. In our 2025 sixth annual State of Healthcare Hiring report, we learned that only 1 in 3 nurses feel satisfied with their career advancement options. 46% have experienced physical or verbal assault in the last year, and they've shared that flexibility is massive in their decision-making criteria. The organizations I'm seeing hire top talent are going beyond the standard sign-on bonuses and market rate increases, and they're getting creative with their offerings. They're incorporating flexible scheduling and self-scheduling options. They're putting in place mental health benefits, on-site childcare. They have clear, documented career advancement pathways for growth. And they're asking themselves, what does it mean and look like to thrive here and not just survive here? To brag for a moment on Ro and her team, 43% of their hires actually came from an Incredible Health feature known as Direct Connect. This is where a candidate will mark an employer with a heart that they're a top employer, and it actually enables that candidate to skip multiple stages of the process, going straight to phone interview with the recruitment team. 43% is huge for the candidate demand to be that high. It's really meaningful, and it's a testament to Alameda and the way that Ro and the team have positioned the organizations to candidates in the marketplace.
Thanks, Bri. Really great insight into the importance of speed, flexibility around offers, and the benefits of our Direct Connect feature, which I think we'll talk a little bit more about down the line. Ro, you have called the partnership with Incredible Health a blessing and mentioned being impressed by the caliber of candidates. What outcomes have you seen since partnering with Incredible Health? And were there any surprises along the way? On top of that, are there specific results, maybe even unexpected ones, that stand out to you?
Yes, yes to all. I just have to say that we were really surprised by the strong results. It wasn't something that happened overnight, so it was like a gradual ramp up. Um, but what really stood out was the quality of the candidates. We had candidates that we're receiving candidates that had many years of experience, that also have worked in other safety net hospitals. It was refreshing, as I mentioned before, with the use of technology to really connect us with these, highly qualified mission-aligned nurses. They were out there, and this platform really helped us reach out and connect with them. That was the blessing because somehow we were connecting with people that we weren't able to reach before. So far now, we've had over 130 lifetime hires. And these hires are averaging 9 years of experience. And most recently, we had a candidate that had over 40 years experience hired into our case management department, which is excellent. It is really, really great. 70% of our hires this year have been in our hardest to fill areas like our emergency department, labor and delivery, and critical care. Incredible Health was the solution that we needed, especially when other tools and other methods just weren't bringing in the right candidates. It really provided a way for us to make those connections.
I love hearing that, Ro. I think, I'll just echo, like, we feel the same way about this partnership with Alameda. We continue to hear every single day candidates having demand for the organization. They want to be reached out to, they want to be matched.
Mhm.
We see that same level of joy when they have the opportunity to accept offers. So a huge congratulations on the success. And honestly, thank you for letting us be part of the journey.
Yeah,
Absolutely.
I love to hear that 70% of the Incredible Health hires were tied to your most difficult to fill roles. A true
Mhm.
testament to both your operations and the great healthcare talent on Incredible Health. So Ro, I have another question for you. We know that process change can be scary to some, which can create resistance to new tools or process. Can you
Mhm.
talk a little bit about how your clinical and or hiring teams responded to the rollout of Incredible Health?
Yes, it was different. So we started with one recruiter, sort of beta testing it, if you was to say. And, other recruiters were kind of a little hesitant on a wait and see, because they didn't know this was a different platform. There's that natural fear of the unknown, the questions in their mind, like, is this really going to work? Is it going to create more work for me? But that one recruiter that we had who went into it with an open mind found that the platform was incredibly easy to use, and became quickly excited about how intuitive and effective it was. And as you can imagine, as that recruiter was filling their positions, that created some momentum and some excitement. There was a lot of touch points with the candidates, a lot of interaction, and that just became infectious. So other recruiters were like, look, this software is helping us find these people that we didn't know existed out there. And that's how it kind of spread to additional recruiters. It became very clear early on that it wasn't that Incredible Health was just not another hiring solution, but it was a game changer for both the recruiter's experience, and the outcomes that we were receiving with filling our vacancies.
I love to hear that. So in follow-up to that, did you have to do anything with aligning clinical leadership and with HR and talent acquisition to create kind of a unified hiring experience? Are there any lessons you learned from bridging those departments? I think when we were catching up last week, you mentioned that you host nurse leadership trainings. Do these play a role in that type of kind of unification?
Yes. So I'll tell you that it's very important for the clinical leadership team, HR, and talent acquisition to be on one accord. That was very intentional from the start when we decided to partner with Incredible Health. We needed to do some things differently. And it was not the standard for us to have a recruiter and hiring manager meet weekly to discuss their positions or to get feedback on the candidates that were sent to them. That practice is now standard work. That level of collaboration is important for this to be successful. Before we had teams that were just working in silos, and that affected our vacancy rate. Once we partnered with Incredible Health, it was apparent that we needed to have more fluid communication, which naturally just strengthened, the cross-functional alignment between the departments. And we had to be faster. So candidates were coming in, you needed to respond to them faster. You needed to book them with the manager in a more timely manner. So we had to make some key changes on how the interviews were scheduled and just kind of move from an ad hoc to more structured, direct and block scheduling. And that did improve our efficiency because we want these people that are interested in us. We want to be able to make that connection and have those conversations. And what we learned, some lessons, is that if you don't move fast, you may lose this highly skilled and qualified candidate. And so I inserted myself in the beginning to be personally involved with breaking down those barriers between departments, ensuring the timely candidate referrals. So myself working with the recruiter and listening to the feedback and understanding what we can do differently to decrease the time that a candidate was waiting to hear back from a hiring manager. That was important because we didn't just want to move fast, but we wanted to be smart in our hiring decisions. And that also is where I felt that it was important that we had training sessions so that the recruiters and the frontline managers could better understand the Incredible Health platform and how does it work and the alignment on the process to optimize our opportunities. Those types of interactions are critical, and the frontline managers are the ones that are truly making the actual decision on the hire. So I felt that it was important that they understood the software, that their questions were answered, they had the tools, and there was a shared language with the recruiter and the manager. And then also, it was important for the hiring managers to understand the metrics. How is this working across the United States? What else is Incredible Health doing? And that has been powerful. It keeps them informed and it keeps them motivated. Understanding the market is key to understanding the urgency with our hiring decisions.
I love that. It's great intel on the importance around kind of communication, right? And how it
Mhm.
creates that great cross-functional alignment, efficiency, and really understanding the why across teams, I think is really important.
Mhm.
Bri, I have a question for you. Would you mind sharing some of the most common challenges you see hospitals face when trying to reduce that time to hire and what some of the smartest ways to overcome that are?
I think Ro might have just stole my thunder here, you know. Really across nearly every health system, the transition point between recruiter phone screen and the hiring manager interview is the most fragile part of the entire hiring process. It's often the spot where the biggest bottlenecks occur, where time to fill stretches, and where candidates exit your hiring process. Fixing that stage requires just such a high degree of ownership. It requires being hands-on. It requires accountability from all parties. So I would say that's the most pivotal point in any organization's hiring process. What really impressed me, and Ro touched on this, about the partnership with Ro and Justin and Mary and really the entire Alameda team, is the openness they had for collaboration. Together, we were able to delve into their data pretty deeply and evaluate the entire hiring process and understand what was working and what wasn't working. And when we dug into those details, to Ro's point, what we found were gaps in that handoff between talent acquisition and nursing leadership. So together we were able to align everyone from recruitment all the way down to the hiring, or all the way over to the hiring manager, and develop service line agreements, scheduling blocks, and to create accountability. And they, you know, as Ro noted, they were able to really shorten timelines. They were able to increase momentum. We saw less candidates dropping off. And ultimately, this led to the results that were shared earlier: more hires being recognized, a reduction in time to hire, and the experience clip on the nurses who were brought in was 9 years so far. That's a really experienced nurse profile and not talent that I think any of us were okay with losing out on. The other thing I'll call out is how quickly the entire Alameda team really leaned in. Ro would jump in herself if she saw gaps happening. She would help bridge those gaps by having the conversations with both talent acquisition and nursing leadership to understand the blockers and what was going on. And I think that hands-on involvement inspired the teams to start having that ownership on their own. And that's what allows it to look so graceful in today's world. But we won't pretend it didn't take a lot of work. And over the years of partnership, we've continued to refine the process, and it's really enabled us to upgrade the experience for these healthcare professionals and ultimately drive amazing outcomes. But it also has created a lasting impression on both candidates who are hired, but also just candidates who go through the experience, even if they aren't extended an offer. What I'll note is we've seen other high-performing systems across the country where they've tightened up their workflows and they've improved the stage between screening and hiring manager. And it's made all the difference. So I think Rachel's linking in a case study that we have that really just demonstrates some of the outcomes from tightening up this stage in your hiring funnel. So it'll be a good reference, just a resource to reference after today's call. But the truth is, where real transformation happens isn't just in the tech solution, but it's operational discipline, getting leadership buy-in, and ultimately all of us working together.
Thanks, Bri. It was really, really great insights. So now I'm going to move over to a very hot topic that I hear a lot about from my conversations with healthcare leaders and know is top of mind for many of you, retention. Ro, in your experience, what makes a new hire stay, and how early in the hiring process does your work begin to make sure you're retaining these the great talent that you're bringing on board?
Yeah, so retention is just as critical as hiring. It's not just about finding the right candidate, but ensuring that they feel supported and that they want to stay. The onboarding experience is where the relationship began. You know, these people, the recruiter and the onboarding team, are some of the first people that the new hire connects with, and it shapes their first impression of the organization. At Alameda Health, we place a strong emphasis on the onboarding process and recognizing it as a foundation part of the retention process. The other thing is culture. It plays a huge role in retention. So we really focus on creating a welcoming environment where the team members feel seen, valued, as well as prepared. I often ask the team and ask myself, you know, how do we ensure that nurses feel like they're part of the team and that they have the resources that they need to succeed? Um, I think that that's a question that is constantly in my head because it evolves, right? So we are looking at how do we broaden our ongoing education, our clinical training, our career development tracks, and support from change specialists. In our view, retention starts at the moment we engage with the candidate, and it continues through every step of their journey with us.
Ro, just to dig in a little bit deeper on that, how do you capture the sentiment of your own teams to deeply understand what they want and what they need to be successful? And then how have you adjusted really to meet the reasons that nurses are communicating that they're leaving jobs, such as wanting flexibility and clear pathways for career advancement?
So, but Jen, we did that simply by listening. You have to listen to what your nurses want, and then build programs in response to their needs. One of the opportunities we had was to create a transition to practice program. So this helps new nurses or nurses that are generally like in the med surg department. It helps them move into other specialty departments. It gives them training, education, preceptoring in another department to get them tuned up to say to be able to work there. And that helps because then people aren't just stuck in one area because the minimum requirements wants you to have some experience. So we've listened to that and we've created that transition to practice program. And then flexibility, it continues to be a top priority because we are seeing candidates come in that, you know, really value that work-life balance and they want alternative schedules and not necessarily full-time roles. We've seen nurses come in that really just want the gig jobs, you know, where they work a bunch and then they go and they do something else. So we strive to be as flexible as possible, but we also have to balance our staffing needs. So we have part-time options and we get creative with our scheduling when we can. We know that vacations are important and time off for kids and outside activities is important. So we try and be flexible with that. We also have a very strong benefits package. So, you get over 10 paid holidays. We have generous PTO accrual. So really staying in line with the market on what is the standard and what's beneficial to the actual hire. Um, Here at Alameda, we have a labor environment, and so there are some contractual obligations, and so we work to accommodate those um, requests and personal schedules as long as they fit in with our obligations to the contract. And I'll also just say that flexibility works best when it's proactively planned. And so we work to have transparent communication with both our leadership and with our staff.
Really love the thoughtful approaches that y'all are taking. It's such an ever-evolving challenge, and just commend you all on being able to listen so closely to the community and what they're saying, and to meet them where they're at.
Agreed. So, Ro, nearly half of Alameda's hires now come through our Direct Connect functionality, where nurses reach out directly to your team on Incredible Health. That level of inbound interest doesn't happen by accident. How have you approached employer branding to make sure that you stand out and attract that kind of engagement?
We are working very hard at that. And nursing is deeply integrated across our organization. And we're proud of our strong affiliations with our local colleges and universities. In particular, we have an affiliation with USF, University of San Francisco. And that's where Alameda Health serves as a home clinical site for their nursing students. And that gives them the opportunity to complete their entire rotation here within our system. So they start here and they end here. And that early exposure really allows the students to get to know our patients, our communities, and it builds familiarity in our health system. They go all over our health system with the hope that we will be creating a pipeline to be able to fill our positions upon graduations. As I mentioned before, the transition to practice program, which creates that career pathway for nurses to move into different specialties across departments. And our education and professional developments are very important for us. They're key pillars. We believe in investing in our nurses and building those long-term relationships. We've spent a significant amount of time on brand recognition and awareness and ensuring that our prospective nurses understand who we are, what we value, and why they should choose AHS.
Just going to say yes, yes, yes to all of that. Um, what I really loved is being able to follow along as you all have been doing brand enhancements and making the cultural shifts to really resonate with candidates as well as employees. It's been really fun for us to be able to reflect that into places like your showcase page and your AI messaging,
Mhm.
SEO and co-branding. I won't pretend it's easy, but it makes it easy for us to be able to attract qualified candidates through that partnership and that brand work. So yeah, a huge kudos on all of the work. We know it's not easy, but it's certainly working.
Mhm.
I love it. All right, I'm going to shift over to the buzzword of the year, AI. Bri, I would love to hear from you where you see the biggest opportunities in bringing AI into the healthcare hiring process are.
Yeah, I mean, AI is coming into every industry, and healthcare hiring, it's not really a question of if, but how quickly we end up adopting it. The reality is that healthcare organizations are being asked to do more with less. You're being asked to fill more roles, meet higher demand, and to do it without growing your teams. And for me, that's where I see the biggest opportunity. On the talent acquisition side, AI can really step in to handle repeatable, time-consuming tasks. Things like creating job descriptions, sourcing across large talent pools, screening and matching candidates, automating follow-up and scheduling. These are all areas where AI can bring consistency, speed, and ultimately scale. We already see some of the value in day-to-day operations. AI can help clear the desk of administrative work so recruiters and leaders can focus on the human side of hiring, the building of relationships, aligning talent with the right opportunities, and solving workforce challenges strategically. The way I think about it is that AI is amplifying our people, and it allows us to really become a force multiplier. When you can reduce burnout, free up time, and accelerate results, you enable your team to do their best work. And that's ultimately what leads to stronger hiring outcomes and downstream, better patient care. For me, the exciting part is that I think it's just the beginning, right? The opportunities are only going to continue to expand over time, and the organizations that lean in now are going to have a really competitive edge.
I agree on all those points. There's so many efficiencies and ways to bring in AI into your kind of day-to-day that support you and the team being more successful in achieving and exceeding your ultimate goals. Ro, for health systems that are still using some outdated hiring models or longer workflows, what would you say to a clinical leader who's hesitant to try something new with AI and just a new solution?
Yeah, you got to step out of that. The goal is to hire faster and smarter, not just for efficiency, but to support, your long-term strategy for workforce stability. It's not just about hiring anyone or having a warm body, but it's about finding that highly qualified candidate who strengthens and complements your existing team. With Incredible Health, that app is really good with matching those needs, that the qualities of the candidates and your mission and what you're looking for in a candidate. It really blends them together nicely. And we really have to make it our business to reduce our reliance on temporary staff, so registry staff, because that can lead to burnout amongst permanent nurses. They often feel overburdened and unsupported when they're constantly adjusting to new team members. I believe that our nurses should be treated as the professionals they are, and that starts with a thoughtful and respectful onboarding experience, investment from the organization from day one, treating them well. That way you can retain these skilled individuals. And that all leads to higher satisfaction as well. Ultimately, it's my thought that happy and supported nurses provide better, safer, and more compassionate care for our patients.
Isn't that the truth? Ro, how do you approach balancing new graduate nurses with experienced nurses on your teams? And why is that mix so important for long-term success, retention, and ultimately patient care?
Oh, yeah, that's very important. And it's also a safety precaution that we need to ensure is tightened up there because you have to have a balanced team of new and experienced nurses. And that creates a strong foundation for growth and for high quality care. So experienced nurses, they really serve as your preceptors, your role models, and they play a critical role in the onboarding, orienting, and precepting of new staff. Our new nurses bring that bolt of fresh energy, new perspective, and it balances out with the seasoned nurse who provides that clinical expertise and that stability. So we work really hard to distribute new nurses, evenly across shifts rather than grouping them in bunches or throwing them all on the night shift. We want to make sure that we have safe staffing and proper support and development for those new nurses or just nurses new to the organization. So we really strive for a well-rounded mix across every unit with new grads, mid-career nurses, our veteran staff, with all of them contributing to team strength and a long-term retention of our staff.
That's great. That's really great. Okay, so I have one last fireside chat question, and then we can open it up to the group. So as a reminder, if you have any other questions, just add it into the Q&A box at the bottom of the screen, and we can get to those in a second. So I'd love to ask both Ro and Bri. Maybe Ro, you can start first, and then Bri can go. What innovation or trend in nurse hiring are you most excited about as we look forward?
Well, I'm excited to continue this partnership and with Incredible Health. It has shown to be the solution that we needed. Still really focusing on increasing the pace of execution with faster onboarding. And I know I keep saying faster, but that's just really the way to go. A key priority is keeping our vacancy rates as low as possible. Um, the goal is to ensure that we have incoming hires that are highly skilled, well-trained, ready to contribute immediately. We're looking forward to sustaining a talent pipeline that balances speed with quality. That's what we've been getting from Incredible Health.
And Jen, you asked me earlier about AI in healthcare, and I would be lying to you if I didn't pretend that that's what I'm most excited about. I just truly see the pace of innovation and how incredible it is. And it's already reshaping how hiring happens today. Even in our world at Incredible Health, we're not just talking about what's possible, we see the results. We have AI personalized messaging that's increased the percent of nurses who say yes to having a conversation by 20%. We have an AI resume wizard. It allows a candidate to generate a resume in 5 minutes. I don't know about y'all. I've generated a resume before. It did not take me 5 minutes. We have a voice-based AI agent, Gail, and this is an AI agent that does actual conversations with candidates to prepare them for upcoming interviews. There's just so many things that are happening that are improving candidate engagement, elevating the experiences, and at the same time creating real efficiencies for hiring teams. So I would say the only other thing I'll note is that we at Incredible Health are developing our very first AI agent for employers. So that's the other thing I'm excited about. This agent is going to be able to screen, interview, and even sell candidates on opportunities, meaning that organizations can do more hiring without having to further scale to support organizational growth. And I'm a true believer in protecting the bandwidth for our healthcare hiring teams. They're absolutely critical to our success. And given today's workforce challenges, we need to make sure that we're protecting them. So to me, that's the trend that's the most exciting. AI taking on the repetitive work and becoming a partner in hiring so that recruiters and leaders can focus their energy where it matters most, relationship building and getting the best talent into roles faster. Ro, now I'm using faster.
The way to go.
Keyword of the discussion, right?
Yes.
Buzzword.
Yeah, it's not AI, it's faster.
Yes.
Well, thank you both for such an honest and energizing discussion. Before we head to audience questions, I did quickly want to share how Incredible Health supports systems like Alameda Health and how we can help you too. So one of the biggest benefits to our partnership is the support we provide in the first half of the hiring funnel. This success is really driven by that AI technology that we talked about today. We're sourcing and screening every nurse and technician that wants to join Incredible Health. All candidates on our platform are pre-vetted and qualified, leading to only 25% of nurses passing the screening from our talent team that our talent team conducts. We collect over 90 data points in totality between the candidate profiles and employer preferences. We're looking at 70 plus specialties and over 250 skills so we can appropriately match candidates. It is not as simple as specialty. We're able to hone in on geography, overall experience, years in specialization, education level, and so much more. From there, we're creating efficiencies and automation with scheduling interviews, communicating with the candidates, and highlighting your most important roles and the benefits to joining your hospital. At Incredible Health, we view ourselves as an extension of your team. The Incredible Health AI technology is going to do all the heavy lifting in the first 4 steps of the hiring process. This allows recruiters to focus their time on the most impactful steps of the process, speaking with the best candidates, partnering with hiring managers to exceed hiring targets, and ultimately hiring the best experienced candidates, resulting in those higher retention rates, more experience in the hospital, and cost savings to the health systems as a whole. We understand that any investment needs to show real value, and at Incredible Health, we deliver on both efficiency and ROI. You will hire permanent nurses and technicians 4 to 5 times faster, cutting the national average time to hire from 86 days down to less than 20 days. It's not just about speed, though, although that is critical. We also help you hire those more experienced professionals. The average nurse hired through our platform, as we talked about today, has 9+ years of experience, and that leads to a 15% higher retention rate. In fact, our health systems are seeing on average a 5 million return in annual savings thanks to faster hiring, better retention, and a major reduction in the need for costly temp labor and overtime hours. That wraps up our content, and now it's time to answer some of the questions that have come in throughout the presentation. If you have a question, a reminder, you can submit it in the question box, and we have some time to get through them. So let's see what we have here. The first question here is for Ro, and said, what's been the most surprising feedback you've received from nurses or hiring managers since partnering with Incredible Health?
Well, I don't know if it's surprising anymore, but the managers are really enjoying the candidates that they're getting. And the candidates are really enjoying their time with AHS. So what it's showing is that it truly was a good match. And really, as far as the process, I've heard that the process has been well. It went seamlessly, and that candidates actually appreciate that interview that happens pretty quickly. It allows them to make a decision, know where they're going, and it puts the worry out of, which job am I going to next? Because now they've had that interview. They've already had their questions answered.
That's great. All right, so we have another question, and I think maybe Ro, you can start, and Bri, obviously jump in with any other things that you're hearing from other conversations. How did you engage with marketing and other teams on creating a strong, unified employer brand strategy, and where did you start in the conversations?
So yes, we did engage our marketing team just with putting out real stories, making sure that our brand was out there on other platforms like LinkedIn and things of that nature. Really highlighting, working with recruitment and highlighting our vacant positions on other platforms outside of our main launch site. And then with Incredible Health and being in the spotlight, that helped as well with some of the brand recognition. And we follow it up with, we have a tagline here, real patients, real care. So that along with having these high quality candidates and staff working with us has really helped with that brand recognition because our quality scores have improved, which is excellent.
That's great.
Don't know that I'd have much to add to that. I'll say in our partnership, we're typically going to work with both HR and nursing teams to ensure that we're refreshing brand content regularly. We have different places such as an employer showcase page where we can really highlight the brand and then continue to evolve that as benefits and as changes happen at the organization, including cultural changes. I also noted earlier in the conversation about our generative AI messaging. So our generative AI messaging does go out to candidates within 24 hours of a request, prompting them to say yes to that request. And that does pull components of the brand to really ensure that candidates know the benefits of joining an organization. So we've been able to partner really nicely with our friends across the aisle to really continue to highlight the brands in that way.
Great. So there's a question around kind of the conversion in the hiring funnel. So what one change made the most significant difference in reducing candidates submitted to hiring manager to marked for hire time, really cutting back on the interview cycle to hiring decision?
I would say direct booking of that interview is the most significant change. And if it wasn't direct booked, an immediate book, whether they call the manager to get a time, that to me is probably the biggest difference.
I'm nodding my head because same. Yeah. If you can get candidates on hiring manager calendars during the phone interview, you're going to be ahead of most. The only other thing that comes to mind is if your hiring managers require reviewing the application or the resume, that's a step that you absolutely want to have removed. If you can create the cohesion, like Ro talked about, between hiring manager and recruiter, where they truly do understand what each other's needs are and what we're looking for in a hire, and you can build that trust, you're gonna save a lot of time and a lot of back and forth. We know that everyone's inboxes are flooded, so save the email.
Mm-hmm.
Great. The next question I'm going to point to Bri for. So, what roles outside of nurses can Incredible Health source? Any allied health roles? And if not, how is Roe creating a pipeline of allied health talent at AHS? So, Bri, maybe you can answer the first question, and then we can hand it over to Roe to talk about allied health.
Yeah, within the space of nursing, I think there's like the thought of staff nursing, but we also support, I'm going to say like non-traditional routes. So home health nursing, ambulatory surgical nursing, CRNAs, nurse practitioners, all fall underneath the categories that we as Incredible Health do support. As far as allied health, we do support technicians and technologists. So we're expanding through different states, but we are live in California and Georgia and continuing to expand our reach. So underneath of the allied health umbrella, that's technicians, technologists. So that's going to include things like surgical and imaging techs, diagnostic techs, your rad techs I hear about all the time, the therapy areas, so respiratory, you name it, we pretty much cover it. I want to say it's like 60 plus tech categories that we oversee.
Roe, is there anything else for you to add that you want to add around kind of creating a pipeline of allied health talent?
I would just add the school affiliations. So really having a relationship with the colleges and universities or vocational programs in our area, and being open to taking people that are new graduate out of their programs and training them. That has been probably the best pipeline that we've had so far.
Great, thanks. So one last question for Bri. If hospitals want to work with Incredible Health, what is the best way for them to talk with us and the process we follow?
Yeah, absolutely. So if you'd like to learn more about partnering with Incredible Health for your nursing needs or your allied health needs, the best place to start is to reach out directly through our website. That's going to be on the screen in front of you. So incrediblehealth.com/book a demo. And from there, one of our dedicated team members will reach out to set up that initial conversation. We want to deeply understand your specific hiring goals, your challenges, and those clinical priorities.
Thank you. Roe, we want to really thank you again for joining us today. It was such a great dialogue and conversation. And everyone on this call, thank you for joining us. We really appreciate the incredible work you're doing, the patients you're serving, the teams you lead, and the lives you change every day. We're here as a partner to help you move faster, hire smarter, and lead your organization through this next phase of healthcare transformation. So the incredible team, like I mentioned earlier, will be following up with everyone to share a link of the recording. You can also reach out to us at questions@incrediblehealth.com or by visiting incrediblehealth.com, book a demo and filling out the form. And we look forward to continuing the dialogue and having conversations with all of you. Thank you for joining us today, and we will be in touch. Thank you, Roe. Thank you, Bri.
Thank you.